Good. Hey guys, it's Dr. Tyler from T0 Physio. We're just going to go over some deadlifting with back pain today. In the beginning, we're going to go over some forces that happen on the spine, some common back pain, how I like to classify back pain when I'm treating somebody that has a pain when they're deadlifting. Then we'll go through our setup and then how to pull through the deadlift. We'll go over some common faults that we see when we're deadlifting. And then we'll see if there's any questions at the end. So to start off, the first thing I want to go over is our forces on the spine. So when we're looking at any force on the spine, there's three different types that we see most common. A rotational force, so something that's trying to rotate our spine. A shear force, so we have an anterior translation of our vertebrae on top of the other. So and then a compressive force. So when those vertebrae are starting to push down on top of each other. When we're talking about deadlifting, there's really not too often we're going to have a rotational force. We don't see when people pull, they twist too often. We see that more like when we get overhead and then like a snatch or a clean and jerk. But we typically don't see that too much with the deadlift. So we're not too worried about that. So the one that we're the most concerned with when we're talking about deadlifting is going to be what's called a shear force. And so the shear force is that anterior translation of the vertebrae on top of each other. This happens when we do loaded movement. We end up in like spinal flexion or extension while we're under load. I'm not saying that we don't ever want to flex the spine or extend the spine. It's perfectly normal. We want our back to go to move. It's not a problem at all. It should be able to do that pain-free. The problem arises when we do that with a large amount of load. There's always going to be some movement of the spine when we're deadlifting. It's just going to happen. But while we're deadlifting, we want to do our best to maintain a nice stiff spine over top of each other. So a compressive force is actually shown to help with spine health. And just like anything, if we have too much of the compression, we can have problems. That's where we start to have vertebral end plate fractures. But also the way we fix those vertebral end plate fractures are by adding compressive forces. We just need to manipulate the volume and the load and intensity in which we're doing those compressive forces. So when we deadlift, we really want to avoid that shear force. And so what we're going to do, that's going to kind of segue how I like to classify our low back pain patients. So we have flexion intolerance, extension intolerance, and then load intolerance, back pain. And so a nice, easy way to classify that back pain for me is to have somebody do a cat-cow. And I'm going to have someone come up and demonstrate our cat-cow. So we're going to have Kalika come up. We're going to get fours. And so if she's coming to us with back pain, what we want to notice is where she ends up in this nice neutral position. I'm going to have her go up and down. So she's going to flex at the hips, go up and then down. And typically with somebody with back pain, they're going to have pain in one of the two directions. If they don't have pain in either direction, I'm going to start looking at a compressive force. And that's another easy one to test for. So say Kalika says, ouch, that hurts going up. We can say, okay, she has flexion intolerance. If it hurts going down, she has an extension intolerance. And I use this when I'm working somebody with deadlifts, go ahead and relax, with somebody with deadlifts, because if they have an extension intolerance, they hate this extended posture, that's perfect. That makes a deadlift super easy. All we have to do is really cue them out of that extension, and we'll go over at the end. If she has flexion intolerance, so if she doesn't like to go up this way, that one's a little bit trickier because she's probably doing something throughout the deadlift where she's unable to maintain her spinal position of neutral. Let's go back down. So we're going to put her in this position and try to teach her how to maintain that through a deadlift, and we'll figure out how. So once we figure this out, if they have one or two, if she doesn't have either of those, the other option we have is to do a compressive force. So we're going to grab a box real quick. Go ahead and have a seat on the box right here for me. So we grab that box, we're gonna have her grab the edges of the box and she's gonna pull down as hard as she can. And so if that causes some pain in her back, we're gonna know that that's our compressive force. And this is the tricky one. So if we have compressive forces and we wanna deadlift, those might be counterintuitive. We wanna get the symptoms to kind of downgrade a little bit before we start loading her spine. If she doesn't have pain with this, we can move on. If you do have compressive pain, I really recommend that you see a physical therapist, come to someone like T0 who knows how to work through our barbells and go from there. But for the flexion extension, we can kind of work around that. And for the compressive forces, I definitely recommend we see somebody for that. So let's screen Kalika and see if she's ready to deadlift. Go ahead and lay down on your back for me. I'll get this out of your way. So the first thing I like to do, let's flip around this way so everybody can see how awesome you are. So first thing I like to do is have them do an active straight leg raise. So go ahead and, yep, screw that. Perfect. So what we're gonna have first do is active straight leg raise. She's gonna push this ground and this leg into the ground, and this leg's gonna go up. We're gonna see how far she gets. What I'm looking for, go ahead and relax, is that she can get at least 70 degrees to somewhere around 90 degrees of hamstring length, and then back down, and then we'll do the other leg. The other thing we want to check for are any asymmetries. Kalika's awesome, no asymmetries here. And then always check, is there pain with either of those? Nope. So if you don't have any pain, you can relax that leg. If you don't have any pain, we've cleared that test. The next one that I like to do is called a forward bend. Go ahead and stand up facing that way for me. Have her touch her toes. What we're looking for here is that she clears the ankle crease. So we just want to be 1 or 2 above the ankle, and she doesn't have any problems with that. And then we ask, any pain with that? Nope. Again, if you have pain, we want to get you referred out. For her, she's cleared for those. The next one we're going to do is have her demonstrate a hip hinge. You can do this 2 different ways. You can have a PVC pipe, which I don't have on me right now. Put it on the back of the head, the upper back, and the hips, and then have them hinge and see if they can control that. So we'll see Kalika and see if she can hinge down. I'll move out of the way. So Kalika does a good job of hinging. She's got a little bit of a rounding here as she starts to go down, kind of in her probably like L5, L4 area. It's not a big deal. Come back up. Give me a slight bend in the knees. Really think about shoving your hips back. So she corrects that pretty well. Go ahead and let your arms dangle down for me so we can see how that looks. Good. So she's kind of where we're at. So this is actually a great example. Go ahead and stand up. So Kalika's having a hard time maintaining postural stability. Awesome. We got a PVC pipe. She's having a hard time maintaining a position of pelvic stability and diaphragmatic stability over top of each other. But she has the requisite mobility in her hamstrings. So why is she doing that? And that would be probably a motor control issue. So let's try this again with the PVC pipe. We'll give her some external cues. So try to keep the pipe right here. Let me get on the other side. Let's try to keep the pipe on the upper back and the hips. So go ahead and hold on that. I'm gonna have you take your arms here. And then the other one over top. No, go ahead, flood the other way. There we go. Sound effects are important. And see if she can maintain that. And already, once we give her that cue, she's already in a more straight line. So go ahead and hold on to that. I got the pipe. Go ahead and touch your legs, touch your knees. So she's already in a much better position where we want her to be. So there's a couple different ways we can train. Go ahead and relax, sorry. I'm just making you hold the positions forever. There's a couple of different ways we can work around that. Anytime we can have a motor control like fault, we can add some load to the system, and that can change. So a goblet hip hinge. So you just give her a kettlebell. Look at this, we got kettlebells. Awesome. So she can take her kettlebell, hold it, and hinge back and see if that changes anything for her too. There you go, good. So she's still got that little rounding back here. It's not a big deal. I've definitely seen worse. I'm gonna cue her to stay knees forward a little bit. There we go. And now it looks a little bit better, and come back up. Another option is she can hold the kettlebell behind her on her hips and then push back into the kettlebell, see if that makes a difference. So again, we're just feeding the system with load. And that looks a lot better in that position. Does that feel more comfortable? Yeah, awesome. So you can go and relax, put the kettlebell down for me. So those are kind of our 3 things I like to do to see if somebody has the prerequisite to deadlift. And Kalika definitely does. We might have to change her positioning a little bit, working on taking the deadlift from the block. So instead of deadlifting directly from the floor, we could just lift the bar up slightly. So instead of starting here, she would start in this position where she owns that already and finish the deadlift. We'll come to that in a little bit, but that's kind of an option for her. So going back to talking about the deadlift, I'll use you again in a minute. So going back to the demands of the deadlift. So we've classified talked about forces on the spine. The next thing I want to talk to you about is how we have moments. So this could get a little bit nerdy here. So if you think back to your physics, we have 3 different type of moments that happen on the body rather than not just the back when you're deadlifting. The first is our spinal flexion moment. The second is a knee extensor moment. And the third is a hip extensor moment. These are important to kind of have an idea of as you're starting to get heavier in the deadlift, because this will show you where your faults are happening at. So with a spinal flexion moment, this is going to be super important because the more force that's going to be required from your spine is actually more of an anatomical point. So if you're somebody with like a longer torso, you're going to have to be more upright on your deadlift. So imagine if I was tall and I had to, which I'm not. So imagine if I was tall and I had to be able to deadlift, my spine would be more upright. That's going to put more pressure through my back. That's really important as you start working with taller athletes, that you need to work on keeping their spine more erect. You're going to have to work on more spinal stability. The second thing is our knee extensor. This one gets to be tricky because your quads are not going to be your limiting factor in your deadlift. The quads, their job is actually going to be stopping the tibia from being pulled backwards by the hamstrings as they co-contract. So that's going to be the limiting factor, is your ability to keep the tibia from translating backwards. That's what the quads will be doing over the patella tendon. The third one, and probably the most important one, is the hip extensor moment. The hip extensor moment is going to happen when we're closer to the floor. So when you start to pull from the floor, that's when our hip extensors, our glutes, hamstrings, all those guys are going to be doing the most work. And again, the longer the femurs and the shorter your arms, the more hip extensor work you're going to be, because you're going to be, and the hips are going to be farther away from the bar as we start to pull. So as your hips go farther from the bar, our hip extensor moment goes up. So that kind of takes us into our setup. So if you keep those in mind, you can kind of diagnose the faults that you see throughout the deadlift. So let's go ahead and have Kalika come back because she's super strong and she's going to deadlift this 135. Perfect. So we're just going to go over the setup first. We're going to go over the setup first off. So I'll get out of the way again. So when Kalika approaches the bar, we're going to have her pretend like she's going to do a vertical jump. And I want you to pretend like where you jump, you're going to put your feet. So would you jump with your feet that wide? So she's probably going to do a vertical jump with her feet just under her hips. And that's what you'll find. That's really normal. Yeah. So now she's thinking about it. So when we're talking about our hip strength, you're going to be the strongest, most likely. And this is different. You'll see people have much different stance width. But when we're starting out, I always have people start with their feet right underneath their hips. If they're a larger athlete, you may need to go a wider stance just so they can make room for their stomach to get out of the way. It's totally normal. If you look at some of like the world's strongest deadlifts, the 1,000-pound deadlifts, they got really wide stances. So with Kalika, we're going to have her feet just underneath her hips. And then also we're going to play around with her toe out. So you can have toes pointing forward, or you can have them slightly out. If your toes are slightly out, it could be a couple different reasons. It could just be because we have anatomically very different hips. Everybody's hip shapes are a little bit different. Me, I like to have my right foot toed out a little bit more than my left. Also, when you toe your foot out, it puts your glute on stretch. So you can have what's called active insufficiency and passive insufficiency. This will, if you toe out, it's going to help with getting off the floor. If you have a more neutral foot, so if we go more in here, she's going to have a much easier time locking out the deadlift. It's not going to be like a big difference. It might give you like a 5 or 10 pound PR, depending on how you play around with that. So that's another variable. The second thing we want to do is have Kalika approach the bar. So we got our toe position. We got our foot position. Next thing she wants to do is cover up her shoelaces with the barbell. So she can't see her knots right now, which is perfect. That's exactly what we want. The second part is, the second part of our foot position on the floor is how we're putting pressure into the ground. You'll hear people talk about keep on your heels. I would prefer most people keep what I like to call the tripod foot, and what I guess I stole that from Squat University, but that's okay. So the tripod foot. So the heel, the big toe, and the pinky toe should all be in contact with the ground. And she should be trying to grip the ground as she starts to deadlift. So now we've got our shoelaces, our foot position, our toes all kind of going on actively. We're going to cue Kalika to push her hips back to the wall behind her as far as she can. She should start to feel her hamstrings load. Once she gets there, we notice a nice flat back. I'm going to have her squat down to the bar till she finds it. Perfect. What we'll notice with Kalika is that she's got somewhat vertical of a tibia, which is what we want. She has a nice, really good spinal position, which is what we like to see. Now, when Kalika goes to deadlift this bar, I'm going to cue her to push the ground away as hard as she can. Don't think about picking the bar up, but push the ground away. And then I want her, once she passes the knees, to squeeze her hips and pull her hips through at the top. Go ahead and give me a 135 deadlift. Let's go. There we go. And Kalika did a great job. She didn't overextend at the top, which can be a very common deadlift fault. She stayed nice and strong. She had a little bit of lumbar flexion. Go ahead and go back down the same way you came up. Perfect. Go ahead and relax. So one thing you'll notice with Kalika on her way back down, just so you guys can see me, She started here, and instead of going hips back like she did when we set up, she squatted down. And so she was telling me the other day she had bruises on the front of her knees, and that's because she's squatting that barbell back down. So to be really efficient when we're doing multiple reps, we want to think about hips back, then down. So let's try again. Oh, it's a little heavy. Good. And what you'll see is she's got shoulders, then hips, then knees. That's exactly what we want. So she's going to go ahead again, push the ground away, squeeze the glutes once you pass through. Good. She did a good job there. And then we're going to go back down. But this time when we go down, we're going to go hips back to the wall. Yes. There you go. That feel better on the knees. Yeah. Awesome. So that's going to be a really great setup for her. And again, once you kind of start deadlifting more, you can play around with your foot position, go wider, go narrow, go more narrow, go toes out. The next thing I want to address is the hand placement on the barbell. So Kalika did a naturally great job. We worked a little bit with her deadlift again, but say Kalika didn't know what she was doing and she thought, oh, I need to go a little bit wider. That's going to create a longer pull, a longer lever. So always try to keep the arms as close to the thighs as possible without getting them in the way. So that's perfect. I'm not going to make you deadlift again. Perfect. So let's go over breathing and bracing. So for our breath hold, we do what's called, when we start to lift heavy, what's called a Valsalva maneuver. So you want to get down into your deadlift. She's in her form. I'm going to cue her to take a big breath. When you breathe in, I want you to breathe all around. So 360 degrees breath, big breath. And then when you go to stand up, hold that breath. And I want you to stand. Good. And as she breathes out at the top and then back down, hips to the wall. I told her I was going to make her do another deadlift. Perfect. So she held that at the top. So what happens is when we take our Valsalva maneuver, we take a deep breath and we hold that breath against our glottis of our throat, and that's going to create a lot of tension. This will sometimes cause some back pain. So again, if you have pain while you're doing a Valsalva maneuver, that's something that we actually should get you treated on. Don't just train around it and think you'll be okay. We want to get you in to see a physical therapist or a doctor or whatever your healthcare provider is. So for that, that's perfect. The other thing we can talk about is a belt. So a lot of people will start to train with a belt. You get back pain, doctor says, go use a belt. It's probably not the best idea. A belt is going to be just like a crutch. So if you're going for like a 1 rep max deadlift, by all means use a belt. But if you're training in pain and you think that a belt's going to do the trick to help you, it's not true. You're probably pretty weak around your core musculature, or you're not able to keep a good rib cage pelvis position. And that's going to be a big issue. So we want to keep those two in mind when we're doing that. If you're using a belt to train around pain, either drop the weight or go see a provider that can help you kind of traverse those injuries. So once we get through the belt there, let's talk a little bit about common faults. So I'll demonstrate these faults. That way you don't have to do that. So the first fault I see most common is the rounded back deadlift. So when we go to deadlift, we're here. They start to pull, they're in a good position, and then they kind of lose that position and they pull up and it gets nice and round. And then they come back down in the same way. So this can be caused by two things. They can have a really back spinal erectors where it's really weak in the low back and they don't have that ability to maintain that good position as they go through, or it can also be weak hips. So how we kind of determine that out, if they seem to be always pulling with a rounded back, no matter what the weight is, that's probably going to be an upper back strength or spinal erector issue. If it's about 90% of your 1 rep max, and you start to see that rounding, that's going to tell us that it's weak hips, because you have the ability to maintain that strength throughout. But what happens is we start to round, and it actually changes the moment arm for our hip extensors and makes the pull a little bit easier for those. That's going to happen around 90-95%. So I'll give you a kind of a really good idea of where you're going to be at with those two. So once you figure that out, you can add different types of accessory work to your training and really work on those as well. The other very common fault that I see, and this one happens a lot with CrossFit, is I call it the no rep dysfunction. So in CrossFit, you don't want to get no rep. It's not great. You have to do the rep all over again. That's not a problem. But it does become a problem when you start to have back pain when you're deadlifting. So what happens is people will go to deadlift, they'll come up here and they're going to pull all the way through so they don't get no rep, and then back down all the way through so they don't get no rep. That's going to be a recipe probably for a lot of back pain in that low back. And you're going to typically see it right around that low back right here, kind of going across. We really want to learn how to pull through with our hips and not our back. Don't worry about getting no rep in training. If you're training for a competition, that's something different. We can start to integrate that in a little bit and build up some resiliency. But what you want to focus on, if that is your problem, if you notice that happens a lot with your deadlifts, is when you go to deadlift, you're here, you're going to pull through. So once we get to the hips here, we're going to squeeze our glute, pull the hips through, and we're going to keep our rib cage down. So what you'll notice is my rib cage is over my pelvis, and that's going to make the most strong position for my core. And then back down. When we're doing that, we really want to focus on not overextending at the back and not pulling through with our low back, but pulling through with our glutes, which are going to be the strongest part. And so that's it that we have today. We have any questions? No questions? Awesome. If you guys need anything at all, let us know. I know if you're watching this, you get an 80% off your first eval. So if you have questions, for sure, shoot them in the messages and we'll see you soon.